Zweli Mkhize is visiting community clinics, emergency services, public and private sector hospitals in KwaZulu-Natal just to see how they're handling the COVID-19 pandemic. He is speaking right now. Let's cross to that.
Posthumous post-mortem examination, the PCR test gets done, and therefore we have to go back and reconcile with the various records of the patients, how the patient had been admitted, and so on. We just want to make a call to our people that it's very, very important that in order to contain the spread of the COVID-19, we need everyone to stick to the containment measures. We must all wear masks as soon as we get out of our homes. We must all ensure distancing. We must also ensure that there's hand washing, sanitation, sanitizers, which we must use. And if you're carrying gadgets like the media is doing, you must have sanitizers and keep wiping all your gadgets with that, because somebody will just touch on it and then of course it passes to the next person. It's very, very important for us to realize as well that there is no special way of reducing the spread of this infection other than the indications that we have given of the use of masks. Now, I must say as well that our impression is that more people have started using the masks, and as you move around you can see so many people using the mask, which was a challenge before, because I think there was a lot of complacence where people felt that well, we're now in level 1, so it means we can just do anyhow. This has really backfired on all of us, and I think we must say that this resurgence has happened in a way that we had actually not expected, that it was firstly going to be so quickly, and it was going to happen even before the festive season, and that it would happen with such high numbers, which are much more than the numbers that we had seen in the earlier surge in June, July, August. So because of that, therefore, we need to know that how we behave is what determines how the spread of the infection is going to go. So in the past few days, we are getting indications that there might be an inflection, which therefore means that we want to encourage our people to say we may actually be seeing the reduction in the next 2 to 3 weeks, because of the intensive use of masks, hand washing, sanitizers, and distancing. We really have to work very hard to push this curve down again. We've done it before. We can do it again, and I think it's important to say that with the past few weeks of the restrictions that have been put in place, we are beginning to see some green shoots that are indicating that we may actually get this surge coming down quite a bit. The risk, of course, is that if we have got complacency, it can actually resurge at any time, and therefore it must be clear that it's all within our hands to be able to contain this. Our focus now is that whilst we want to make sure that there's good management of all the people who are in hospitals and who are treated at home, but it's important to say we are now going to be focusing on spreading a lot more messages about the vaccines. We will, in the next week or so, announce more of the vaccines that would have been able to confirm. So at the time when everything is ready, we will come and be transparent to the public. But what I think is important is for us to begin to create an awareness on everybody that there is going to be a very important need to embrace the vaccines. And in embracing the vaccine, we need to now start encouraging all those who are in the priority groups to be moving ahead and getting ready. We need to get all those who are health workers to be in the forefront, and after that we'll also make sure that the teachers, the police, and people who are working in overcrowded settings, who are working closely with communities, taxi drivers, waiters in hotels and so on, are prioritized so that we are able to take a lot of those ahead and treat them and give them vaccines so that we can reduce the spread of the infection. We'll talk a lot more about it as well, but as of today we have been moving around. What we can get in the province of KwaZulu-Natal is that there's a lot of concern that the numbers of people who are infected is still very high. And I can say that looking at the numbers here, we're more than the numbers, the positivity rate per day or per week is almost twice as much as what we had. And therefore, even as the numbers might start reducing, it's going to take a while before the provincial health system will begin to feel that there's any kind of reduction. So we need to really emphasize on the need to use the mask, as it were. We've been to various communities, clinics, big hospitals. We've been to Prince Msheni. We're still going to go to 2 other hospitals, Kwamash Polyclinic and the private hospital as well. What we are seeing is that the numbers of people who are presenting in the private hospitals are much, much more than what we had seen before, to the extent that now they've got to be diverted to the public hospital. And we're also seeing that in some instances there's a bit of reluctance on people to attend hospital early. So you get a history of someone who might have been sick at home, and then 2-3 days then they pass. And I want to also make the call. I've heard that the provincial government leadership has made this call. I think it's important to say to our people, let's come to hospital as soon as we get the symptoms so that we can be assessed to see whether there's a need for us to be treated, to be admitted, and so on. Sometimes it can be very misleading. You feel a bit weak, you feel a bit tired, and you think you are resting. The next time you know it, you've actually got so much shortness of breath that if you can't stand up from your couch to the bathroom or to the bedroom, you must know that it's really quite late. That means your oxygen saturation has dropped significantly. So even in the absence of recording your pulse oximeter, it's important for people to understand that when you are no longer able to stand unassisted, sometimes it's even difficult to take off your coat or to lift your hand. That basically means your level of body weakness is now affected by the shortage of the oxygen in your blood. And so the next impact that is going to be the impact on your brain. It's going to be impact on your the rest of your body. So it's important that we must encourage people to come in early to the hospitals, to come and make sure that they get attended to. I do want to pay tribute to all the health workers. I've spoken to a number of nurses, I've spoken to a number of doctors, and asked them how do they feel. They have said to me that yes, they are feeling a bit exhausted. They do feel that there's been pressure. They've never had enough time to rest, but they're feeling strong. They're feeling motivated to continue the fight, because what is fulfilling to them is how we save our own people. I want to therefore, on behalf of government and the society in general, pay tribute to our health workers and say we want to say thank you. We do appreciate all the hard work, the dedication, and the extent to which some of them go beyond the call of duty to save our people. We appreciate that, because at the end of it, it's the only thing that stands between our people's life and death, and therefore we do appreciate that. I have checked as well. I was asking about PPEs. It does appear that the issues of PPEs have been largely been attended to, so that even if there is a problem, it's something that can be attended to and solved locally. And therefore, we want to say to our management that we have said before, if health workers don't have good protection, it's unfair to send them to work. It's therefore important to say they must continue the work of providing the PPEs and so on. I also want to thank the unions, because they came out strongly. We are now partnering. We have actually said unions must ensure that their members are part of the team that looks at the issues of availability of the protective gear. And at this point, we want to say that it is not a fight, it's just a responsibility to make sure that your co-workers are safe, whether you're management or union leaders. All of us must make sure that we're working together insofar as that part is concerned. So we have moved around. There are areas where there are shortages of staff, and we've made a call that the provincial government has to work hard to open up more posts and make sure that people are actually appointed into all of those posts. There are in some of the areas where you see that even if they were to fill up the posts, the establishment is stretched because of the population increases, and therefore those issues need to be given additional support so that short contract employment is also possible to augment that situation. So all of this is what, as we're walking around, been noticing, but it's also clear that our own people are fairly aware of this. We went around talking to the mothers, to the young people, to the elderly. Everyone understands now that this issue of COVID-19 is very serious, and they are taking responsibility to prevent the spread of the infection. We are actually continue to commission additional beds, as in this particular facility, the additional beds that have been commissioned, so that as we move on, if the numbers are still causing a lot of pressure, it should be possible to get extra beds to be able to take more people. We've also raised the question, which is now, I'm glad it's also been implemented, and that's a question of a district bed bureau, where in any district there must be a coordinated sharing of information to look at the numbers of beds that are available. So one person who is sick, then you put a call to this bureau, then at the end they must be able to find a bed in a different part of the district than where the patient was actually first admitted. So people must understand they'll be moved to different parts of the district depending on the availability of bed, and that is very, very important. I've seen that also as a big problem with the private sector. I want to again call on both the public and private sector here to coordinate, so that when people need beds, they should actually be accepted in a hospital, irrespective of whether they came through the public or the private hospital. It's very, very important that we must see the people on the first few hours of their admission. The use of oxygen has gone very high, and we also have actually asked from the MEC to submit to me a report to indicate where they are actually having difficulties with oxygen. But we understand that the oxygen utilization has been increased now, firstly by the fact that our experience in the previous surge was that oxygen, early oxygenation is what helps to contain the infection or to contain the whole COVID problem. But secondly, that even in district hospital, we should have more oxygen, so that you don't have to wait until you're at an ICU to be given oxygen. But they've also now started distributing CPAP machine. Now CPAP machine are what we call continuous positive pressure equipment, which basically puts the oxygen just in front of the person. So when with a small, very tiny effort to breathe in, of course the machine helps to augment the breath in, and that the person can breathe equal amount of oxygen as though they would have been strong enough to do it on their own. It's just one step before you can get the ventilators. Now we avoid ventilators because it's very difficult to wean persons off the ventilator, but nevertheless when it becomes necessary, of course we go that route. So the point therefore which we want to make is that we will be monitoring the use of oxygen. We're going to be interacting with the leaders who are in charge of the oxygen production, so that we ensure that we keep good levels at this point. I will be moving up to a few other provinces. I will be visiting Limpopo and of course Gauteng, because that's really where we see the numbers have gone up. If you look at Limpopo, the numbers there are more than what there was in the previous peak in June. If you look at Gauteng, the peak is almost the same as what it was in June. We were just worried about the fact that moving from the holidays, people are going to be moving up back to Gauteng, and that's going to give us huge amounts of resurgence in that particular part of the country. So we have to monitor throughout the whole country for that. Western Cape has actually increased, but for the past few weeks it has plateaued at a very high level compared to the previous one. So we're hoping that what we are seeing now are indications that it's going to start declining as well, and we're hoping that we need to see next week whether there is any new impact from people who are coming back from the festive season, because that is the time that we thought that the real pressure was going to come from. But that the pressure came at a point when we put up the level 3 modified restrictions has actually assisted a lot. So from where we sit, we believe that the use of masks, has been taken seriously by our community. I want to encourage society to continue with the use of masks, distancing, hand washing and sanitizer. We're beginning to see the impact of that, and we believe that if we continue, we'll actually see the plateauing of the infection. That's one very important issue. Secondly, we think that the introduction of the level 3 with modified restrictions has assisted as well to encourage less of overcrowded settings where people would then be exposed to super spread activities, particularly during the festive season with lots of parties and lots of big gatherings and celebrations and festivities and so on. We still have to appeal to our people during the funerals that the numbers have to be restricted. We still get reports of areas where the funerals are still attended by a large number of people, and sometimes when people attend, the families kind of feel, well, what can we do? We must say a lot of people get infected when they come to bury someone, and the following week you start seeing more people who are getting infected. So funerals still remain a concern, and we want to send a message strongly to religious leaders, traditional leaders and families that to help us, we need to make sure we keep to the number of 50 people, and in the process we also need to make sure that there are sanitizers and that people must stay far. There are some of the traditions or even church groups that have got traditions of taking off the body of the coffin and rewashing the body, and they do so. I doubt that they are able to do so with proper sanitizers and so on. We would like to keep the management of the body hygiene to the funeral parlors who have got a clear understanding of all the regulations, and therefore would like to encourage everyone to respect all these precautions that we have given. It's very, very important that families, as painful as it is, and we do understand it, as painful as it is, that we shouldn't actually start touching the body, going back to wash the body. And if we have to view the body, there's a procedure that must be done with the supervision of those who are trained to do it, so that we don't spread. We don't lose one member and then spread the infection to even more members. And so that's the appeal on the issue of funerals. Now, the other issues really relate to us having to send a message right across to all the communities that they should attend hospital as soon as they can, so that they can be given attention. Some people fear going to hospital, and as a result, by the time they get to the hospital, it's too late to give them assistance. Our hospitals, yes, they are under pressure, but there will still be a way to accommodate you, to get you in to be treated appropriately. And so from that point of view, we'd like to encourage our communities to continue to go and work, to go and attend to the hospitals. Having said all that, then I just want to say thank you to the teams that are busy doing the work. On the ground, we do understand that we are working on a very difficult situation, but from the point of view of the National Department of Health, we do appreciate all the work that has been done. We appreciate all the support that we get from the President and from the different departments. It's very, very important that we must continue to work together. It's only when we are united as South Africans that we are able to contain the problem of the spread of COVID-19. We actually must also indicate as well that there's a huge relief in most of our major hospitals that's been occasioned by the situation of the suspension of the sale of alcohol. Most of the pressure came from casualty departments, where people came in because of violence, interpersonal violence, gunshots, stabbed wounds, motor vehicle accidents. All of these have been reduced. Now that has helped us to reduce the pressure and the exhaustion of our health workers, who had to divide their attention across the COVID emergencies as well as trauma emergencies. Now with the suspension, we have actually seen a very good correlation whereby the reduction on the consumption of alcohol has actually resulted in fewer and fewer people presenting with debilitating trauma that occupies the ICUs, that occupies all the resuscitating equipment. And at this point, we are able to focus on the one crisis that is facing the whole country. And therefore, we want to say that there is actually a huge relief that's come from the suspension of the sale of alcohol, because most of those trauma cases are linked to irresponsible consumption of alcohol or irresponsible behavior based on the consumption of alcohol. And hopefully that's going to continue for a while, that we get this space to be able to manage people who are actually under the pressure of COVID-19. So we will then continue to monitor the situation and see when there would be need to change in terms of all the restrictions that have been put in place. At this point, I think it was unfortunate that the resurgence came at the time of the festive season, because the conduct of people during the festive season is that they would be congregated in overcrowded settings. They are actually less cautious, they are more relaxed, and therefore that really created a very difficult situation. So those of us, whether from churches to some of the particular sectors that use maybe the arts, the sports, the culture, sectors, would like them to please understand that we need a space to be able to deal with the problems that we are facing right now. So we thank them for their support and their cooperation. And as we move on, I'm sure there will come a time when we would have gone through, all of the challenges, would have been able to vaccinate our people, would be able to actually stop the rapid spread of COVID-19 to the extent that we are now able to claim back our normal economic activities, our normal social activities. That time will come. We must also just assure South Africans that we are on course in the provision of the vaccines, as we have said. Some people were worried that we might have delayed. We want to just assure there's no delay. We're actually right on target in being able to reach out to get as much of the program in place, so that for the major part of this year, we're able to vaccinate. Actually, what people don't understand is that it's a mad world out there. Every country is trying to get the same vaccination. So even some of the countries that prepaid 8-9 months before haven't still got as much vaccine as they would have liked. So there is a degree of slowing that would have happened in any case. So in our case, we are focusing on getting as much as we can, and at the moment, I must say, things are coming on well. We'll make the necessary announcements when there's additional information to share with the public. But at this point, I think our focus must be on explaining to everyone that we need the vaccines and they are important, and trying to dispel all of some of these concerns and myths and worries that people have, so that we can move on and make sure South Africa is safe. Thank you very much.
Thank you very much, colleagues. In the interest of time, because we're still continuing with our...
Health Minister Dr Zweli Mkhize there, just giving a brief in KwaZulu-Natal, where he's visiting various facilities, saying that he sees that the communities there are taking this issue very seriously, masking up, etc., admitting that indeed there are staff shortages here and there, and moving towards getting provincial departments to open up vacancies so that people can fulfill them and people can get treated. He is saying that if you do feel unwell, don't be scared to go to a hospital facility. Although they're busy, you will be attended to. If you wait until too late, it will be too late. That's all from us here on Point. SA Today coming up at the top of the hour. Have a pleasant one.
At Telkom Business, when we say we'll beat any fixed line voice or internet quote, we mean it. With added value. Make sure you have the tools to seal the deal. We're on it. Give you a reliable connection wherever you are. Sorted. So send your quote or invoice to Beat My Quote to telkom.co.za and we'll beat it. Switch to the partner that works harder To connect your business, switch to Telkom Business.
My holiday was amazing because of my super mom. She says she has a soften-free power to create natural twists, braids, even my sleek, shiny look. It's because of the unique Evo and Honey goodness. My mom says it's so easy to give me healthy hair full of moisture. The itch has gone and my hair smells so good. If you want happy, pretty hair days, your mom can be a hair expert too with soften-free Evo and Honey products. Here's to more mom and daughter moments and a year filled with happy, pretty hair days.
Not the regulator, but the doctors who are conducting that trial would have to be the ones who take responsibility. So I would suggest that they take that route until we can get enough research report to allow the drug to across different jurisdictions. So as we speak right now, we are saying that drug, doctors who wish to use it have to follow those rules of SAPRA. If it's done in the form of a kind of research trial that has been described by SAPRA, they should be able to take responsibility for it in that way.
Thank you. Minister, let me say, just want to hear if you can confirm the reports that some patients, COVID-19 patients, have died due to the load shedding and the generators not taking off, especially at certain aggressive where the report said that about 13 patients died.
Thank you very much, Bongani, for that question. We have received, in fact, we received through the media that there have been some patients that have died because of load shedding. We are investigating that. But let me just indicate what is the actual protocol that all hospitals are expected to implement. Each and every hospital is expected to have a generator, and that generator is expected to kick in less than 20 seconds once the electricity goes down. So if there are hospitals that have lost patients because their generation, well, either because they didn't have generators or because their generators did not kick in, it might mean that there was a lack of management in terms of ensuring that the generators are looked after annually. We as a province have had a challenge with Grace Hospital and adding Northdale Hospital in Mkungundlovu in particular, because that's where we have had a lot of outages in December in particular, and we've not lost the patients as yet, purely because we continuously manage and make sure that our generators are in place. So with that issue that we are raising, we are investigating and we will be engaging with the management of the facility to find out exactly what happened, and then we'll be able to speak to that.
Thank you. Can I just add one thing?
Sorry.
It shouldn't happen that a power outage should result in the death of a patient. Normally, the generators are primed to respond so quickly that, particularly on the power-dependent areas such as theater, ICU, and any such areas, that there should actually be immediate replacement of the source of power if there's a problem. So I would be very keen to see where exactly those reports are coming from. We need to be a bit cautious not to necessarily make a full statement of something that's not been proven yet. I would be a bit concerned as well that we make a statement and everyone else here would think it is true when we've actually not found that out. So my first request would be we need to get the specifics so that we can go into that. It has to be proven that it was linked to the generator. It has to be proven that there was death as a result of electricity outage. So if you have that, then you can make a bold statement. But we get sometimes statements that are conjectural, which at the end are not necessarily true. But the public goes out there understanding that in fact people have died because of it, and it's not true. So I think we need to first get proper information. We don't have that, and we still want to know exactly where which are these patients that are being reported. So if you got some information, I think you should also share it with us as well.
Thank you. Yes, Minister from IRS News. My first question is, how have you used the past 2 or 3 weeks since we started going back into level 3 to augment the healthcare system? My second question is, are we still on course to receive the 1 million doses from India this month and the 500,000 next month? And just lastly, can you change the cost of that procurement of vaccines? Thank you.
You would have died 3 times. Okay. Firstly, I don't have the numbers here. When they are available, we'll share them with you. And we can only give you those numbers once I know that they've been confirmed by both sides. And maybe I think you wait until we say, on such a day we paid so much, then you can get an answer. Speculation is a bit of a problem. The rand fluctuates. The exact amounts and all those details are not really for the public until they are actually firmed up. So we will leave it at that. We're on course to receive the vaccines as we had indicated, and so when they are received, we will indicate that they have been received. The past 3 weeks, we've been going around to different provinces to make sure that we can deal with the issue. The major issue that we're going to focus on is that the level of use of utilization of oxygen has gone very high. So there had to be support to different provinces. Started with the Western Cape, well, firstly Eastern Cape, but then Western Cape. At some point there had to be movement of oxygen from Gauteng to go to Western Cape. We had to also do same thing here, where there should be a very close monitoring on the reduction in the oxygen based on the high utilization level. We've also increased the focus on the increasing the health workers to say that we need to cover areas where there's pressure to increase the numbers. There's also been a lot more coordination between public and private and public hospitals to coordinate the availability of beds so that we can deal with the people who are needing beds, but in the area where they are, there might be pressure. We also had to bring in the rapid tests. Now, what caused a lot of problems in the past is that we've got observation wards where we keep people who we call the patients under investigation, PUIs. So you walk into a hospital, based on the symptoms we suspect you got COVID, and in the process we do a test. Only when the test comes out, then we know whether you go to COVID positive area or COVID negative area. That area tends to be clogged up because the numbers are growing, and yet the turnaround time of the test takes long. Now we've introduced antigen tests. Anyone who tests positive on the antigen test, within 15 minutes can be moved to the ward. So the clogging has been reduced drastically. As a result, therefore, we have actually found that there's an easier movement. I was watching now at Prince Msheni. They had a PUI ward that could contain up to 38 to 50 patients. They've converted into a full COVID ward simply because there's no more space to wait. They don't wait. As soon as you come in, we can confirm within 15 minutes and move you up into the ward. So the ward is now fully, properly managed as a COVID ward because of this rapid turnaround time. The experience that our health workers have got has made a huge impact. It's actually the basis on which we are surviving. They've got a lot of experience on dealing with COVID. So anywhere you go, people don't fear COVID. They know how to deal with it. And that's what we've seen now. When the pressure goes up, you actually can't even see that they're dealing with 2 times as many patients as they were dealing with in July. And yet in July, there was a lot more panic than we are seeing now. That's because of the experience. So that's what we've been doing for the past few weeks.
Thank you. Because of time, I'll take the 2 hands same time, and you are closing now. We really have to move.
Minister Mkhize, just one question on my side. The Premier of the Western Cape is engaged, is in talks
I'm saying, Minister, I'm Simpiwa from the SABC. The Premier of the Western Cape, Alan Winder, is in talks with the providers of the vaccine, basically intending to go on his own vaccination program in the Western Cape without the assistance of the national government. What is your reaction to that? Thank you.
Bongat Rulana from Newsroom Africa. Minister, I'm interested, Minister, to understand, is there scientific patterns or data that tells you why Gauteng, Durban, KwaZulu-Natal, Eastern Cape and the Western Cape have such huge numbers? Is it different to each province, or are there same patterns? I'm just trying to understand, ascertain with this second wave.
Okay, let me do it this way. We have had some discussions with the Western Cape and indicated to them that it is not necessary for one province to go and negotiate a deal for itself. And the approach we are taking is that the national government oversees the entire process and procures. Now, one of the reasons why that becomes important, we're reducing the possibility of the kind of fraud and corruption that we dealt with last time. So we have to deal as government straight with the manufacturers. There are not many, so we've now got a special deviation from the National Treasury to do that. So if Western Cape were to do that, they would have to convince everybody that they need a special deviation beyond what the Department of Health is doing. We're putting money together from Treasury, so we wouldn't actually say a province can allocate the resources that were given them to deal with COVID on other aspects to now divert it to go and put it into the fight against, into the purchase of the vaccines. But if there had to be the case, we would then have to issue an instruction to all the provinces to say you are going to allocate of your existing equitable share so much to be able to deal with the vaccination. Thirdly, there are a number of conditions that are associated with the terms of agreement of ordering the vaccines. No province can sign those and agree. No province has got authority to even do any of those. I have, as Minister of Health, to go and split for a special support from the National Treasury. In addition, I've actually had to table the issue at Cabinet, and therefore it will have to go all those steps if you have to deal with it. If we're dealing with a situation where you had a denialist government that maybe believe that you don't need vaccines, then provinces would probably be at liberty to challenge it and say, well, we think we don't agree. But in this case, someone must explain to me, when we've already got the first dose or the first batch ordered, and we've got a few more, we'll announce in the next couple of weeks, let me say next week or so, and tell me what advantage would be for any province to actually go onto the one side and try and order. What we have also found is that we deal directly with all these manufacturers. We deal with their global CEOs. I talk to them. We deal with them. We get a team set. And sometimes the presidency, sometimes the Minister of International Relations, sometimes various people have to deal with them. It's a rather mammoth task to negotiate that kind of consideration from the various manufacturing companies. I would still be interested which of those manufacturers would have a deal with the national government and still want to cut a side deal with the province. Thank you. Yours. Yes, you are raising the issue about the science. Interesting. We had lots of models that we used in the earlier search. Those models actually predicted that the highest numbers, firstly that the surge is coming, they predicted high numbers of the surge, and in the process they predicted that the highest pressure will be Gauteng, followed by KZN, followed by Western Cape and Eastern Cape. So it didn't quite follow that trend because Western Cape started and moved on a surge first. And so the others followed, but the pattern was pretty much what was predicted. So it models and everything. When we came to the plateau around September, we then had a determination from our teams as to what would make us realize that we're now getting a resurgence. So they set up a formula that basically says that let's monitor every provincial, every province to look at the daily cumulative daily positive tests that are coming. Any province that would begin to break the 1/3 of the previous height of the surge, then is already on a resurgence. So first was Eastern Cape. It broke, and then we, for a while, thought it was just a limited outbreak, but after a while it became very clear that in fact it's actually quite on a proper resurgence. It continued that way. It even went a bit higher than what it had had before. Then of course next was the Western Cape, and again we had a public declaration that this was the case. Then came KwaZulu-Natal and Gauteng. We can show you every province. Limpopo has done so, and we can show you this on each and every province, how we've tracked it as it was getting past the surge. The last to do so was Northern Cape. But we also were monitoring them because around September, the large numbers that we're seeing in Limpopo, Northern Cape, Northwest, and Mpumalanga were a delayed surge from the first wave. And so it took a while to actually settle down. No sooner had it settled, did it now start to ascend. As we're watching now, literally all of the provinces are indicating a tendency towards an inflection of the curve. It's too early because people have just moved. So you can't start celebrating. Firstly, because people are still going to now show the impact of the movement, but at the same time, you also want to be sure that over the period you don't have a false sense of security, because your numbers don't stand up straight. It's not like a straight line. They go up and down. So that's why you don't take 1 day's report. You also compare 7-day running average. You compare 2 weeks, average, and then you can make a conclusion. We're just saying to our people that we can see the impact of the wearing of masks. If we could continue and more people would wear masks and distancing, we would actually make sure that there would be a change completely. So there are ways of being able to predict that. Every day I look at these maps, I look at these graphs, I look at these numbers, and all the provinces do the same. Our indications are that, for example, the Eastern Cape has completely gone over its surge, and they're actually going down towards stabilizing. The Western Cape went up, stabilized into a plateau at a very high level. It's starting to come down. It's still too high to feel or to notice. But because we have actually gone to almost 2 or 3 times what we had before, it's going to take us a while, firstly, to feel that there's a reduction, because the reduction must still first get to below where we were in July, then we can start feeling it. The other one, as I indicated, is that the symptoms tend to follow about 2 weeks or so after. Then, of course, the fact that this time we've got a variant, we're seeing a high level of infection where too many people are infected. So the numbers are going to be much higher for a longer time than before, and the deaths will also track much later. So we're watching all of that. There's a way of being able to show that if we sat down in a graph, we'll be able to just demonstrate that. Thank you.
Thank you very much, Minister. The second leg of the program is continuing. We're going to Pamatu, then we'll be up to Umhlanga, and then we'll have another last leg at Umhlanga. I'll request to Acting Mayor Nechokji and Minister to go inside. Thank you very much.